Hello, and thanks for joining us. My name is Dottie Howe, and I'm the Communications Director for the Ohio Health Information Partnership, the nonprofit organization that manages the CliniSync Health Information Exchange, as well as provides services through CliniSync Plus. We work with hospitals, physicians, and other healthcare professionals to make sure they're connected electronically and that information flows easily from one provider to another. Welcome to our series, Using Your EHR to Successfully Manage Patients with Hypertension and Diabetes. We've produced this video series through cooperative agreements funded by the Centers for Disease Control and Prevention. Its contents do not necessarily represent the official views of the Centers for Disease Control and Prevention or the Department of Health and Human Services. The Ohio Department of Health is working with us to help you manage your patients with hypertension, diabetes, or both conditions. Many of you already report measures on hypertension and diabetes through the Meaningful Use EHR Incentive Program or the PQRS program. Two of the most common measures, tracking blood pressure measurements for your hypertensive patients and tracking elevated A1C levels among your diabetic patients, are the focus of this video. Let's look at each of these measures separately before we explore how to capture the measures within your EHR system. The measure titled Controlling High Blood Pressure is known as NQF0018, CMS 165, or PQRS 236. Despite the different numbers, the measure is the same as to how it is calculated. When you want to know if your patients with hypertension are under control, you can run a report out of your system that will give you the number of hypertensive patients whose blood pressure is 140/90. This will be the numerator of the measure. The report will also tell you how many patients you have seen with a diagnosis of hypertension. This is the denominator. Your EHR system will automatically exclude individuals who have been diagnosed with end-stage renal disease, have had dialysis or a renal transplant, or are pregnant. The diabetes measure called hemoglobin A1C poor control is known as NQF0059, CMS 122, or PQRS 001. The numerator of this report will measure all your patients diagnosed with type 1 or type 2 diabetes whose hemoglobin A1C lab test was greater than 9% or who do not have any A1C results entered during the reporting period. It will compare this number to all your diabetic patients seen during the reporting period, which is the denominator. The number that is calculated is the percent of your diabetic patients who are considered poorly controlled. A lower percent is considered better because it means fewer diabetic patients are poorly controlled. Now, let's see how you can use your EHR system most effectively to manage your patients with hypertension or diabetes. Scott Mash, our Director of Consulting Operations and HIE Outreach, has engaged several practices to share with you their real-life experiences. These practices provide tips and suggestions about using their specific EHR. Although your EHR is only one tool that you can use in managing your patients with hypertension or diabetes, it's a highly effective one. Some of the items we'll be talking about include setting up clinical decision support rules and order sets to use for patients with hypertension or diabetes, documenting the patient's status during a visit, and managing patients between visits using patient reminders, patient lists, or clinical quality measure reports.
So I'm here with the team from Fisher Titus. I have Lisa Cooper, Melissa Friend, and Brandy Bartley. So let's start with telling us a little bit about your EHR, what modules you have, how long you've had the EHR.
We are using the GE Centricity product. We've been using it since 2003, and it is the module that we have is a Centricity practice solution.
So the intent of this video is to demonstrate how the EHR functionality can be utilized to improve care and outcomes For patients with hypertension, of course, to know where you are and set a goal, you have to be able to generate a report on the two CQMs, NQF18 and NQF59. Can you talk us through how to do that within the GE Centricity product?
Right, so GE actually moved their meaningful use reporting out to what they call clinical quality reporting, better known as CQR in the GE world. Depending upon when you signed up for CQR and went to version 12 for Centricity Practice Solutions, depended upon which dashboard you got. So there's a CQR1, CQR2, and CQR3. For the one that we're going to show you today, we're going to CQR2, which is known as dashboard.cqr.gehealthcare.com. So Lisa's going to log into that right now.
Now that we're in the dashboard, can you take us through how we can access those two clinical quality measures?
So when I'm looking for it, instead of having to scroll down, because you could just scroll down through all of their measures, I just use the Control F function. And then for diabetes, if I start typing in diabetes, you'll see that it gives me, there's one of 7. So I can then kind of scroll down for the diabetes poor control, diabetes foot exam. So depending on which one you're looking for, we can scroll down through.
So within this measure, can you, let's say, perhaps click on the where it says unmet 15 and get a list of like patients that are non-compliant with the measure?
Yes. So if we click on the number here, it will pull up a list of patients for us. So from here, I can go ahead and I can see who the patients are. If I scroll over here, and I can actually export them to a PDF. So I can print those and give them back to the staff to work the numbers to follow up with these patients.
Let's take a look real quick at the hypertension. So we've just searched for hypertension, I'm guessing.
There's our hypertension, improvement in blood pressure.
All right, one important feature within the EHR is the ability to document and track a condition for a patient. So within the GE Centricity EHR, can you show where we would go to access the problem list and then how to, we'll say, add another problem?
Okay. So once you are in the patient's chart, the first screen that it comes to is their chart summary. From there, you can see that the problem list is here. We could scroll up and down from here, but sometimes we like to expand that. It makes it a little bit easier. You can come over here and click on problems, or this little button right here will actually expand your problem list as well. So I can see my diabetes is here in the problem list.
So with this patient, I noticed they do not have hypertension on their problem list. So can you show us how to add a problem?
So if we were going to add a diagnosis outside of a regular office visit, we could go ahead and hit the add problem right from here. If I click on that plus, it will open a chart maintenance, and then I can actually search for my hypertension here. So depending on if you're searching for it by the name, or we can search for it if you know what the actual ICD-10 is. So we know ICD-10 for hypertension is I-10. So then you can kind of, you see all of these are I-10s. So we want to look through here, see which one is going to be the closest to what we're looking for. So we can even put in here just high blood pressure, and then we can hit OK. And so then it's on there, but we need to make sure that we sign it so it stays on there. I can go ahead and hit end and sign document, and now it's on the patient's
So one important feature within an EHR is the ability to create a list of patients. Can you demonstrate how we would do that? Let's create a list of patients with hypertension and or diabetes.
Okay. So we're going to come down to chart reports. And then we have to put in what criteria we're looking for. So I could put in here, I want to find patients and then it gives you a whole bunch of different things that you could pick from. But if we scroll down here and I pick problem ICD-10 active, and then you'll see here that I can either do contains, there's a whole bunch of different things there, but we're going to hit contains. And because it's looking for the ICD-10, we're going to put our I-10 in and we're going to add. I'm going to click here for my active patients only because I don't want to find patients that are no longer with us. So even though we check marked active patients only, I don't want to search patients that have been in there for several years that have not been back to see the doctor. So I can put where appointment date is on or after, and then we can go back 2 years. Oh. And add that criteria as well. Now I can come down here and I can click count, and you'll see that it returned 7,712 patients in our database. If I wanted a list of those patients, now I could click search, and it will give me the list of the patients. And if I needed to print that list, I could come down here and click print, and it'll print out a list of patients for me. So if I was going to work this myself, I could come up here and I could click on the patient, double click on it, and it will take me right out to the patient's chart. And then if I needed to go back to my list, I can click right back on chart reports and my list is still here.
With some EHRs, you have additional functionality around the patient list. So let's talk through the actions that we have under this select activity. So of course there's print, which you're going to get this list of patients, but what's the send alert flag and send reminder do?
So the send alert and flag is going to send a care alert on the patient's chart to whatever user that we routed the flag to. It puts a little pop-up in the patient's chart.
Okay, and the send reminder?
The send reminder is going to take us out to print a letter. So if we wanted to send a reminder to the patient to schedule an appointment, or they need to come back for a follow-up, get their lab work done.
So in theory, what we could do is create a patient list for all of our diabetics that are overdue for an A1C. When we get that list, then we can do a send alert flag to alert the care team that the patient's overdue, and then at the same time click the send reminders to send out a letter saying, hey, you're overdue for your A1C, get in here and get your test.
Yes.
So we're going to run through the criteria to create a patient query that would show all of our diabetic patients that their last test or last A1C was greater than 7. So Lisa, can you take us through how we would put that patient list query together?
Yes. So the first thing that we would want to do is, tell the query, give me any ICD-10 that contains E11. So E11 is the prefix for diabetes. So this way I'm getting them regardless if they coded them as a uncontrolled or controlled. Then we're going to add the appointment date is on or after 3/1. So I want my patients that are getting ready to come in to make sure that they have their A1C done. And then I'm going to look at the patients that have not had an A1C done since 10/1. And then those numbers needed to be greater than 7. So when I put that criteria in, and I come down here and hit count, you'll see that it returned 173 patients. So now I can hit my search. Okay, so once I get my list of patients, then I can come down here and I can go select activity. So if I wanted to send an alert or flag to the patient's chart to say that we sent them a letter, we could do that. Or I can click on the send reminder, and I'm going to look for my diabetic letter to send to them to ask them to have an A1C done. So if I look in my folder listed diabetic education, you'll see that here is my letter. And if I click print, then it will print a letter out for every single one of those patients that we can mail out to the patient.
So the next functionality that we are going to look at is around patient education. Can you demonstrate the functionality for identifying, providing educational materials for diabetic and hypertensive patients.
So we have in our system, I'm gonna actually click on our problem list. From in here, so for diabetic education, if I want to give them something, I can click on the diagnosis here, click on the I for patient education, and then it's going to bring up care notes. So you have an option of which one do you want. So if you just want type 2 diabetes in adults, I can click on this. And it's going to ask me if I want general information, inpatient care, or discharge care. So we'll pick our general information in English, and it'll return a patient education. So I can come up here and click print. I can record the handout in my chart, which will also give me credit towards meaningful use to make sure that I have my patient-specific educations printed.
So is there a means of providing education around medications? Let's start by demonstrating how you would print the education for a medication that's already on the patient's chart.
So I could click on the medication, the same as I do in problems, and I can click on my I up here. So is it the injection? Is it the oral liquid tablet? So she is on the tablet. Again, I want it in English, and it will print out your education.
So let's say the provider is going to prescribe a new medicine, let's say atenolol. How would you add that to the chart and print the med?
Okay. So they can add a new medication here. And we have custom lists built for our providers. So as they start typing into we have a custom list built. So as they start typing in atenolol, it will drop it down, brings in their instructions already for them. And then we can associate high blood pressure with the medication by clicking on the problems if you're not already there. Clicking on high blood pressure, it will associate this problem with that medication. I can come down here, give them the quantity and refills. And then this little button here where it says print patient handout, we can check mark. So I can click on the print patient handout, and then once they print the prescription, it will also print out a copy of the patient instructions like it did on the previous screen.
So does Centricity have the functionality for building and using order sets?
It does. We do have some built in here. If you come up to your orders and you find the custom order list that you're looking for, we have one called charge sets. And we'll scroll down here to our adult. So you can see that here is one for a preventative patient that is between the ages of 40 and 64 for an established patient with commercial insurance. So I can click on the top here and it will order all of these tests for me. We have to be careful with using these because if the patient had already had some of these things done or the doctor didn't feel that those were absolutely necessary for the patient, he would have to come back in and uncheck the ones that he did not want. So if they didn't want this one or they didn't want this one, they would have to just uncheck those.
And then when they hit OK, sign order, the orders go through the system and flow to the lab and wherever appropriately. Can you demonstrate how we would, let's say, modify or create an order set?
Yes, so to modify an existing order set, you're going to click on your little navigation button down here so you get administration. And you're going to pick the codes, charts, order sets, And then you'll get a list of the available order sets within the system. You'll scroll down till you get the order set that you need. So we have a diabetes ECMA order set in here. So if I decided that I did not want this electrolyte panel, I can click in here and hit change. It will then bring up the list that it's associated to, and I can scroll through that list and pick whatever appropriate lab I want to be able to replace it with. Or if I just didn't want that order set at all, I could go ahead and remove that from the list, or I could click new and add one into the set.
So in addition to lab tests, can you add a medication or like a common med that's prescribed, or other items other than a lab order?
So order sets in Centricity, the only thing that it will actually allow you to do is go by an order type. So I can either do a service, a test, or a referral. It does not allow for problems in medication.
Does Centricity have functionality for building documentation templates or kind of a shortcut documentation methodology for the providers?
Yes, they do have some custom content built in the system. So we're going to come back into our update. So from the HPI, they can come over here to the side and there are custom forms that they can add. So you'll see there's a diabetes form here and there's also the hypertension form. So simply check marking the diabetes form will insert the template. And so when I click on my diabetes Q&E, there's a template that they can complete. It has the history, exam, there's the self-education, diabetes treatment, and if they're on insulin.
Perfect. Can we take a real quick look at the hypertension form?
Absolutely. So they have their hypertension form, and then there's also additional tabs across the top for the hypertension as well.
So if the patient is in the office and the provider would like to review the patient's labs, can you demonstrate how the provider would pull up an A1C, how they could view that with the patient?
Okay, so if I am a provider and I'm looking for the last A1C, we have two different options. If they have a flow sheet view, they can come to their flow sheet. Depending on what criteria you have in your flow sheet, you can see if I scroll across here that it was done. We have also created a quick text for our providers to make it a little bit easier for them to catch that stuff on the fly. And then when they put this in, it'll allow them to answer a few questions up here for the diabetic patients. And then it's also going to give them their most recent diabetic screening. So you can see that hemoglobin A1C was done on January 3rd, and it was an 8.4. They also had their foot exam and their last diabetic eye exam on January 3rd. And you can see that there's not a result for microalbumin, which should trigger them that the patient is due and there's not one documented.
So can you demonstrate for us how we would access the patient's family health history? And let's look at the relatives, maybe add a relative that with hypertension or diabetes.
Okay. So for this patient, we can come down here and there is this histories. So if I click on histories, I can see what the patient's family history is, what their past medical history is, but you'll notice here are our father and mother listed here. If I needed to add a family history to this patient's chart, we could start a clinical list update. So we're going to add in our family history form. So if I come up here to, it will pull in my family history. So if I needed to add, say, my maternal grandmother, typically how we instruct our staff to do it is if I click here on family history, other medical problem, and then I can come over here and put all of the issues that the patient has had, all of the issues that the patient's family member has had, all in one line. And so when I click save, they'll all come in as one instead of on separate lines like you can see here where the mother has headaches and melanoma on separate entries. So I can end and sign my document, and you'll see now it's here in my family history.
So within GE Centricity, does a provider have the ability to create a favorite list, the items that they prescribe or tests that they order most often? If so, can you demonstrate how that functionality works?
Sure. So they can develop a custom list pretty much for whatever they want. In the navigation on the left-hand side here, you'll click the arrow button so you get administration. Once inside of administration, you're going to click this button that says chart, and you're going to see I have an allergy custom list that I could do. I have an immunization custom list that I could do, medication custom list, and I also have a problem custom list. We'll go ahead and do a medication one. If you click on medication custom list and I do new, I can name the list whatever I want. We'll do ZZ test. And then it'll give me pretty much a blank slate. I can go ahead in here and click new. I can pick a medication, and I can even go as far as determining my instruction. So if I know that this medication, I give the same instructions every single time, I could go ahead and put it in here. And go ahead and add it in there, and I can keep going until I have it completed. Same thing for problem list. I could come in here, do a new one. And the way this functionality actually works is once I go ahead and have this in here, when I'm on the chart side, I can start adding to it. I'll have Lisa demonstrate that portion of it.
So Lisa, you're going to show then how we utilize this functionality during the patient visit.
Okay, so we're going to go back into our visit. And up here at the top, we have our little shortcuts. So if I was going to add a medication, you'll see currently right now, I'm on the FTMC med list. So instead of adding to that one, we'll go down to the one she just added to our ZZ test. So if I start typing in here and I don't see the medication that she had, it's not returning, I can come out here to the reference list to add another medication. And I can search for it. So I can come out here and I can say I want to do the 40 milligrams. Again, I can put my instructions in, and then I could put in my quantity. And then you will see down here at the bottom, it says add to custom lists. So I can add the medication. If I want to add the instructions and duration, I can do that as well. And then I could even go as far as adding the quantity and refills to that custom list. And then when I change this to hit save and continue, it will be in this list now. So as I start to type Lipitor, you'll see that it's added there.
So within every EHR, we have functionality for what's commonly referred to as CDS rules. Those annoying little pop-ups that remind the care team member of some item. So can you demonstrate the pop-ups or the CDS rule functionality within the EHR?
So if I am in the chart, there are obviously a few different ones depending on the criteria of the patient. One in particular is if we go back to the hypertension Q&E form. On the hypertension treatment page, down here you can see there's a view recommendations. When I click on this button, it will pop up some therapeutic recommendations for the patient.
Do you also have CDS functionality built in the system for diabetic patients?
Yes, so down here on our CPOE form, if the provider is going to assess the diabetes today, they will just keep popping out at them. And then if they want to add, they will keep popping out at him. And then if they click yes on it, it will give you the other references there. So if I click OK, and it's going to come back, it's going to keep asking if you wanted to add a medication, giving you the opportunity to go back into the chart. So we can click through these. As you can see, there's several for the diabetics.
Now, if you wanted to make a modification to a CDS rule, how would you go about that?
So this one's a little different to be able to do this. Before you would actually have to go through the vendor to be able to get those modifications to the CDS rule taken care of. If I go ahead and open a blank document, type text file editor. So if you go into the CCC text file editor, it'll actually allow you to pick which practice you want and which form you want to be able to edit. Once you have this up, you're going to click the insert values for editing. And you have to actually do it for each page. You'll see it's tabbing through the different pages. So now if we go back to page 1, you're going to see that for hypertension, it has certain instructions listed, and there are clinical decision support selected on top of that. So what you'll do in here is you will actually open the text file to edit it, and you're going to get all this different coding in here. Behind all this coding are actually the files to be able to edit those clinical decision support functions. You can see it's a lot of information. It's not very easy to do at all. You would then, once you have your file edited, you would actually go ahead and save the file, and then you have to go out and you have to import it into each database depending on how many databases you have.
So modifying a CDS rule is not something that's very simple within the
It is
product.
not. Actually, one of the things I would probably recommend and what we do most with our functionality is we actually come out and we just have regular protocols that are built. Those are much easier to modify, and those protocols will actually, they don't necessarily pop up for the provider, but it gives them an easier way of going and trying to find something.
So then when the provider is in the room with the patient, how do they use the protocols, or how are the protocols presented?
Protocols, they'll usually come into the visit and they'll actually click the protocols first, and it'll actually tell them what they're looking at. So you can see for this one, we have the A1C uncontrolled. It will tell them when the test was last done, what the result was, and then it's due every 3 months. This is the all tab for protocols. I can click on do only, and it'll actually show me what's just due for that patient, and I can go ahead and do it that way. We have a couple different protocols built in here. We have the hemoglobin A1C, there's hypertension's built in there. Low dose CT scan, if somebody meets the criteria for that, it'll actually show up for the patient. It's just a little easier to control these and easier for the physician to actually access.
There's been a lot of focus lately on care plans and self-management plans. Does GE Centricity have the ability to create a care plan or a self-management plan, and if so, can you demonstrate?
Yes, so in our encounter type here, you'll see there is this care plan management. So if I click on this, it's going to bring up. As you can see, we already have 2 that are set in here. So I can scroll down and I can click on one of these and I can update, and it'll bring it up, and I can add additional notes to it if I needed to. Or if I wanted to add an additional care plan, clicking on the add, today's date, we're going to come down here. It's only going to give you a list of what's currently in your problem list. So if I click on high blood pressure, there are a drop down for selected standard goals. Not every diagnosis is going to have a drop down for you, but if I don't want to pick one of theirs, I can come in here and I can set in my goals. So I can put here, reduce sodium. And so if I wanted to put a target in there, I can put my target, the instructions, and then I can save and close.
We thank you for your interest and hope this has provided helpful information. If you have questions, feel free to contact us. Scott's contact information is here. Remember, when working with your patient, it really is a partnership between your patient, your staff, yourself, and your EHR vendor. This team approach will ensure your patients will have the most successful outcome. Please be sure to complete the survey at the completion of the video, and thank you.